Hello, my name is Mehul Raval. I'm the Orvar Swenson Professor of Surgery at Ann and Robert H. Lurie Children's Hospital of Chicago and a Professor of Surgery and Pediatrics at Northwestern University Feinberg School of Medicine. So the EnrichUS study is a very exciting study that we've been conducting here at Lurie Children's and at Northwestern University alongside 18 clinical sites across the United States to study the implementation of an enhanced recovery protocol for children undergoing surgery, specifically gastrointestinal surgery. The study lasted about 5 years and identified a number of components to enhance children's recovery after surgery that resulted in improved clinical outcomes, as well as we assessed implementation outcomes, which was very important. The clinical outcomes that we demonstrated improvements on included things like decreasing opioids around the time of surgery. We were able to get children to a regular diet or to regular food faster after surgery. There was a interesting caveat to the surgery and to the study where as children had more of the elements of the enhanced recovery protocol implemented, we actually were even able to demonstrate a decrease in overall length of stay. It really boils down to understanding when we are making these changes, especially with a bundle where we don't know exactly which lever is going to result in which outcome of interest, that we are, first of all, implementing to the degree that we want. So you can call that fidelity or adherence. And so oftentimes, if we make an intervention and we think we're making changes, but on the front lines, we're actually not making changes, if we don't see the results we expect, we think it's because that intervention wasn't really worthy of our investment of energy and time, et cetera. But in reality, it was simply because we didn't implement it as well as we thought we did. And so anytime we're looking at bundles of care, we really should be drilling down and understanding at the patient level which things are actually happening for those patients and which things are not. And only if we know that and we have a high degree of adoption or implementation fidelity, then we can really make some conclusions about whether or not we see the clinical effectiveness of those interventions or not. And so that's one of the things that I'm really proud of in this study is that we were able to look at both clinical effectiveness, the things we've just talked about, opioids, length of stay, complications, patient outcomes, et cetera. But we also looked at implementation fidelity with a great degree of focus. And I think that that was something that was very unique in the surgical literature and specifically in the pediatric surgical literature. It's really tough to say which specific elements. There were about 18 to 21 different elements, depending on how you look at it, that we were trying to implement all at once. There are some pieces of the enhanced recovery protocol that I think are really critical when counseling patients and families and educating them about what the expectations are. I think that's a really important aspect of this intervention. I think that preoperatively allowing patients to take liquids up until an hour or two before the induction of anesthesia and really challenging some of the historic dogma that we've heard about, things like you can't have anything to eat or drink after midnight. That's really not based in science or data. And now we are allowing kids to drink Gatorade or apple juice or other carbohydrate drinks up until a few hours before their anesthetic exposure, which has really made a big difference, in my opinion. We also have, because they're coming in better hydrated, we are using less IV fluids in the operating room. And so there are things that happen while you're under anesthesia, like you're getting IV fluids. And by decreasing the IV fluid rates that we're using with patients that are less dehydrated, we are able to decrease the edema or the swelling that you might see in your hands or your face, but also for an intestinal surgery might be occurring at the level of the intestine. And that can result in a complication called an ileus, which really slows down how fast you can eat and drink after surgery. And then after surgery, I think it's really important to get up and moving and to encourage patients to go for walks in the hallway, to get out of bed, things along those lines. And so once again, it's really hard to put your finger on exactly one or two of the components that were the most mission critical, so to say, but rather if you put it all together in a bundle, There are levers that we can pull at every step that feeds into the next phase of care. And then ultimately, it's the accumulation of all of them, the synergistic effect that really results in the best possible outcomes. That was once again one of the unique insights that this study offered that many other prior studies haven't been able to look into it with as much detail. So the first thing was related to the culture and really getting the team to buy in to the importance of enhanced recovery as a paradigm shift, as a change in the way that we deliver standard care is supremely important. So having a multidisciplinary team that includes patients and families, includes bedside nurses, anesthesiologists, surgeons, et cetera. It's actually quite a large group of stakeholders that really need to be educated about what an enhanced recovery protocol is in order to help pull it off. So having a culture that really supports that type of innovative approach is important. And then ultimately, you're going to run into obstacles. You're going to run into challenges. And so having leadership buy-in, that's another important part of the culture where you have superiors that you could go to that could help move some of the obstacles out of the way and help achieve success for some of the elements that are a little bit more challenging to navigate. So that's the culture piece. And then the other part is a very practical piece of this, which is with so many different components to an enhanced recovery protocol, it's actually quite challenging to keep track and codify like when we are doing these things and when we're not. And so by leveraging the electronic health record that's in place, you can use things like order sets or use the EHR to deliver patient material or educational material, and really help leverage the technology to help make sure that we're successful with delivering various components that are out there. And then also measuring whether or not we're adherent to those components or not. And so, these are the technologies that are at our fingertips, and yet at the same time, unless we really use them in these innovative ways, oftentimes we're not leveraging the tools that we have. So those were two of the aspects of the enhanced recovery implementation paradigm that really helped the hospitals successfully implement the protocol and then get the best possible outcomes for their patients. So we're already working on a variety of enhanced recovery protocols for all kinds of conditions within the pediatric surgical world. This includes orthopedic procedures, neurosurgical procedures, spine procedures, for example. We're doing this for chest wall reconstruction surgeries and general surgery, and even for common things like you hear about, such as appendicitis. We now have enhanced recovery protocols for these types of conditions. But what I'm most excited about is really expanding the horizons of the populations that could potentially benefit from an enhanced recovery protocol. And specifically, our team at Lurie and at Northwestern is working on developing and maturing some of the enhanced recovery protocols that surround neonatal surgical care. So neonates in the neonatal intensive care unit are a very fragile population. There are some real challenges to doing some of the things that we've talked about, like decreasing opioids or advancing diets, and ultimately maybe getting them to where they don't need IV fluids so much as they historically have. And so ultimately, this is going to be a challenging population, but one that could really benefit from enhanced recovery principles. And so we've been working with some stakeholders at a variety of hospitals to develop an enhanced recovery protocol, and we hope to start to test that out in the coming weeks and months at institutions across the United States. And so that's definitely something that we're working on actively while at the same time already moving forward in other domains and other specialties, as I mentioned.